Well, Dr. Peter Chin Hong joins us now. He's a professor of medicine at the University of California, San Francisco, and a specialist on infectious diseases. Welcome to the show.
Thanks for having me on, Jared.
Of course. So, the death rates from the coronavirus in the US are rising again. And it's got nothing to do with the number of testing now. How worried should the public be?
I think they should be extremely worried. We're talking now about whether or not some regions should be in shutdown mode. In California, there's already one county in shutdown mode, which is Imperial County at the Mexican border.
Doctor, one of the biggest topics this week, airborne transmission. Scientists are urging the WHO to consider mounting evidence that COVID-19 could indeed transmit through the air. If this is the case, have we been fighting it incorrectly? How does it change things?
I think it shouldn't change what the public is doing, particularly in the outside. I think what it means is that we take precautions and take ourselves out of risky behaviors. So that means if you're meeting a lot of people indoors, you're not wearing a mask, there's poor ventilation, you're singing a lot next to each other in an indoor setting, those will all be possible situations, and particularly for a long period of time where that aerosolization might be important. But otherwise, a simple mask is good enough.
Is good enough, but is there anything else we need to be more aware of?
Well, I think that we need more research, but it doesn't mean that we go out and buy N95 masks. To me, it's more important how well the mask fits and how comfortable you are wearing it for a long period of time. In the healthcare setting, however, we've been wearing N95 masks under certain situations.
Right, so WHO scientists, as I said earlier, are in China in the early stages of investigating the origins of the coronavirus. Meanwhile, though, some studies say it may have existed elsewhere before Wuhan, and I'm thinking of those sewage samples in Spain and Italy. Explain to us the significance of knowing the original source of the coronavirus.
Well, I think particularly for COVID-19 and SARS-CoV-2, the virus that causes COVID-19, it became such a political issue all around the world, and I felt it in the United States, where it was the source of a lot of Asian hate crimes and Asian hate speech. So I think symbolically it might mean something to a lot of people, but I think, from a medical perspective, it doesn't matter where it came from. The point is we need to keep ourselves protected from it.
Right. Well, so some countries, including China and New Zealand, have managed to bring the coronavirus largely under control from a medical standpoint. What are some of the best lessons from them that other countries can apply?
I mean, it seems pretty straightforward, Jared. You need a national voice, a collaboration between science and politics, and one voice that tells the people what to do. And it's unwavering. And I think in those countries, that was very much the case. Germany, New Zealand, and certainly the Asian countries.
Right, and certainly something we perhaps are not seeing here in the United States, are we?
No, it's like we're acting like 50 different countries.
Right. Now, it's summer here in the United States and in the Northern Hemisphere. It's a big travel season. What's your advice for people who are perhaps a bit skittish still?
I think it's right to be skittish. There are different degrees of risk of travel. The least risky travel is going in your own car. And certainly on the other extreme, it's taking a plane. But again, if you're wearing your mask on the plane, and I would weigh the risk-benefit calculus. Certainly if you're going to visit your mom who's very sick across the country, it's okay to go on the plane and protect yourself. But if you're going for a beach vacation, maybe look somewhere locally.